One of the things that I think I uniquely do in my office is I utilize ultrasound quite a bit. So in my office, if you come to see me and I'm suspicious you could have, let's say, a rotator cuff tear in your shoulder. Yeah, you've taken a day off of work to come to see me. You might have even waited in my waiting room to come see me. You come to my office and I'm suspicious. Now, what I would typically do in that scenario is send you immediately for an MRI, where it would take you another day to get the MRI, and then you come back to see me. Now you're on day 3 and you still don't have your answer. Well, what ultrasound has allowed me to do, I can get great visualization of the rotator cuff or the biceps tendon or other structures immediately around the shoulder just by utilizing an office-based ultrasound. And I can make a diagnosis of suspicion of whether you have a problem with your shoulder, and I can give you an answer right away and often start the treatment right away. And so I think that's had a huge benefit to my patients, because now I can give them answers right away within a 5 to 10 minute ultrasound. And often what I'll do is, let's say that my treatment ends up being a cortisone injection. Now I can accurately place the injection exactly where I want to, because I use an ultrasound to guide the needle into the correct spot. And I think that not only makes the injection less painful, but it gives me confidence that that thing will be doing exactly what I want it to in the right spot. So I use ultrasound every day in my office, and it's really kind of changed my practice in terms of being a better clinician, getting the diagnosis right with confidence, and then when I do therapeutic injections, being able to ensure that I'm doing it right and accurate and expect those kind of results from that. Now, there's one other area in elbow surgery or elbow problems where ultrasound has helped me with a brand new technology, and it has to do with tennis elbow. Everybody knows someone who's had tennis elbow, and tennis elbow can be a debilitating problem that we really don't have consistent, simple solutions. We used to give a lot of cortisone injections for tennis elbow, and we've been sort of unexcited about the long-term success of a cortisone injection for tennis elbow. And after people have tried to rehab the problem and strengthen the arm, and if they still have that problem, what I do now is a percutaneous approach at treating tennis elbow. There's a company called 10X Health, and what they've done is taken the technology that they use to treat cataracts. Cataracts are emulsified with a high-frequency ultrasound. And they take that technology that goes on the tip of a needle, and if I can identify the actual problem of tennis elbow, the scar tissue buildup that happens in tennis elbow, I can then direct that needle with a local anesthetic directly into the area where the problem is, and actually do the same surgery that I used to do under a full anesthesia, in a full surgery with an open surgery, and it's changed the way I've treated that problem. It's brand new. It's been around for maybe just close to a year. I was the first in South Florida, actually the first in the state of Florida, to actually use that technology, and it's because I have a mastery of ultrasound that I was able to make that quick transition to doing this sort of brand new procedure to treat tennis elbow. And tennis elbow is something everybody knows people who have it, and it can be debilitating, but now I have a simple solution that doesn't require surgery. It's still a surgical procedure in that I treat you as if you had surgery. You still have to go through normal recovery process and rehabilitation, but I can do it now without having to put you to sleep, without having to use a general anesthesia and just a local anesthetic. So it's kind of it's something new, something we're fairly excited about, because it's sort of a brand new technology, something unique that we do in the area that no one else does.